Nice to see you all here. All right, so today we're going to talk about something simple, something that I'm going to try to give you some tips that then you can take back with you to your general practice. I always found that like these kind of lectures were very useful, especially for those vets that are kind of scared of a topic then they don't feel comfortable with. So I don't know if you like orthopedics. Do you like orthopedics? Yes, some no, yes. Okay, fine, fantastic. So pretty much like we're gonna try to go through all the stages of a clinical examination, and then I'm gonna tell you something about the most common diseases that most commonly we see. There is no point in me talking about rare diseases that you see once a year, once every 2 years, because that's not what you need. You need to know about the most common diseases, the one that you're going to see most commonly in your practice. So usually first thing which is it's one of the most important things is to collect like a decent history from the owner. So usually, especially when you're talking about diseases of joints, usually you have the owner that is describing that their dog is intermittently lame, that is particularly stiff in the morning after getting up for a while, after getting up from lying down for a while, and usually the lameness improves during the day. So usually this tells you that most of the time tells you that one of the joint is involved, because usually joints with some degrees of arthritis or inflammation, usually that's how they tend to behave. So you got some lameness that is worse after getting up from lying down for a while, and usually just gets better. So usually immediately should tell you, right, probably is likely that we are talking about a joint problem. And usually in regards to medication and use of anti-inflammatory drugs, usually the client may say, yes, it helps, or no, it doesn't help at all. Then, after taking the history, usually the best thing is to see how is the dog walking. So sometimes it's quite easy if you have a dog, like in this case on the left, where is a dog that is not hairy and is white, so it's easy to see, especially on a dark background. But sometimes it can become a little bit more difficult, as you can see on the right side, especially if you have a dog that is very bouncy and very hairy. Usually, what we are looking for when we have a look at the dog walking is that we look for a nod. Okay, we start looking for the head bobbing. So how many of you think that the first answer is the right one, and how many of you think that the second answer is the correct one? So the head, usually when you see a dog walking and you see the head that goes up, is that because the dog is putting weight on the painful leg, or is it because it's putting weight on the normal leg? Normal leg. Lift your hands. Okay, 3, 4, okay. Painful leg? I see the correct answer is the second one. And that's simply because if the dog is trying to unload the painful leg. So it's like, oh, that hurt. Oh, that's okay. Oh, that hurt. This one is okay. This one hurt. Okay, so that's how it works. So usually you need to look when the head goes up. That's the painful leg. So a very useful tip is to use the slow motion of your phones. All of you have a smartphone. All of you are going to have a slow motion function on their phones. When you see a dog that is going in slow motion, everything becomes easier. I use it all the time because otherwise, I struggle sometimes to see when a dog is really painful. So even in a case like this one, where you have a very hairy dog, it becomes a little bit easier to see if the dog is actually going up with the head or is not. Okay, so that usually is a good tip to try to understand which leg the dog is painful on. A lot of times I get cases referred for lameness of the opposite limb, and that's because vets they still get confused because they are not sure which one is the painful leg. So Let's see, slow motion function on your phone, and everything becomes easier, much easier. So then, let's start from low, and we're going to start going up. Okay, we're going to examine all the different joints. So usually I try to be systematic. So I always try from the digit. I always start from the digit, and then from there I start going up. First thing, you check the pads, because most of the time you can have like a little foreign body. You can have that the pad is cracked. Sometimes you can find some dermatitis between the digits. Sometimes if you have a greyhound, for example, you look for a corn. Okay, so for a corn, yeah. I can restart it. So then after checking the pads, usually at the point you start checking every single joint. It's not rocket science. So usually what you do is that you just move the joint to feel, first of all, if they are thickened or if they are swollen, and then you try to feel for some crepitus, for example, if they are crunchy. Or you check for pain, because if you start doing what I'm doing now and the dog tries to bite you, you know that that's most likely to be the reason for the lameness. So it's very easy. You just check every single joint of the metacarpal phalangeal joints, and then you check for thickness, you check for swelling, or you check for pain. Like an orthopedic examination is like a game. You try to find where the pain is coming from. That's what it is. You just try to localize where the pain is coming from. So you need to check every single joint systematically every time in order to be able to find where it's coming from. And if you do it systematically, then you're going to start with experience. You're going to start distinguishing between what's normal and what is not normal. Okay? After feeling like a normal metacarpal phalangeal joint 20, 30, 40 times, at that point you're going to start feeling like when this one is not right. Let's do some x-rays. Okay? So we're talking about corns. So usually corns, they affect mainly greyhounds or lurcher, and usually affects especially male dogs. And usually it tends to affect always like the big pads of digit 3 and 4. So when you have, again, based simply on history and breed, you have like a dog coming through, a greyhound coming through the door, and the owner says, my dog is lame, especially when he walks on gravel, then you know exactly where you need to go immediately and have a look at. So, for example, like this dog on the right, I saw it 2 weeks ago, and this corn wasn't as obvious as you can see there. I could see that the pad was all cracked, but then you couldn't see the corn so obviously. And then, so I was squeezing the corn, and the dog was responding. It was responding to pain. But then, of course, like if I cannot see the corn, I'm not going to start doing surgery simply because the dog showed some pain. So in this case, we start putting some cream, some pad cream, and then after 1 week later, poof, it came out, and it became very, very, very obvious. And so in this case, for example, on this dog, last week I ended up doing surgery to remove it. Usually I use like one of these punches for skin biopsies. I try to go as deep as I can, and then just only cut it at the base and stitch it up with some. Usually I use some Vicryl because I find that it is quite soft, and so especially if you have like a squeamish greyhound, having like a suture that doesn't annoy the foot usually is a good thing. Really important, if you're going to be dealing with one of these in the future, is that to have like a good client communication. So the owners need to be very aware of the fact that complications can happen. So like infection, for example, skin breakdown, simply because we are dealing with an area that is dirty. And especially they need to know about the recurrence rate. That sometimes is up to like a 40 or 50%. So just warn and say, look, I'm going to take it out now, but be aware that it might come back. So don't complain if it comes back. Okay, now osteoarthritis. Sometimes you see dogs that they got like an awful, terrible osteoarthritis affecting the metacarpal phalangeal phalangeal joints. on those cases is quite obvious where the problem is, and usually when you take some X-rays, usually you see some proliferation. Rather than seeing bone destruction, you see proliferation. So I think, yeah, I got some X-rays here. Usually you have a lot of new bone growing, usually around the joint, or like you can see on this way. Usually in old dogs, most of the time is benign, so it's not related to disease. So usually it's not due to tumor. There is no neoplasia. And most of the time, it's just all an incidental finding as well. So again, a lot of time you get referred cases for osteoarthritis of the digits, but then in reality the problem is not coming from there. And actually, if you touch the digit, the dog doesn't even complain about it, but most of the time the pain is coming from somewhere else, like the elbow, most of the time. There was this study done in 2009 where actually they found out that out of 49 dogs, 35 dogs had, in 35 dogs, that was just all an incidental finding, and it was not the reason for the lameness. The reason for the lameness was due to something else. Okay, now we checked the digits. We move a little bit further up, and then we start checking the carpus. Usually, as you can see, usually I like to feel to see if there is any puffiness, to see if there is any thickness, to see if the dog is painful when I'm pressing on the joint. And then the next step would be to try to see if they go flexion, extension, because a lot of time, if they actually have like some serious osteoarthritis, the flexion usually is quite reduced. Instead, like if you have a dog that allows you to fully extend, to fully flex, and it does not complain, you know that carpus is absolutely normal. Even maybe if you see a tiny bit of arthritis on the X-rays. Then the other thing, after checking for flexion extension, I try to check for lateral and medial displacement. So try to check if any of the medial or lateral collateral ligament are damaged, because if one of those was damaged, then you should be able to crank the joint open, both in medial or lateral direction. And also check like in dorsopalmar direction. You need to remember that if you do the same test in cats, usually they do have a massive movement that most of the time is absolutely normal. So don't be scared if when you do this movement you get a lot of movement. That's just only normal. That's cats, unfortunately. At that point, after I've done my examination, sometimes, of course, if you're in doubt, you can compare it always with a contralateral limb and see if maybe they are exactly the same in terms of thickness, or maybe if they are the same in terms of swelling. Usually it does help you understanding if the joint is diseased or is not. So the carpal joint is quite a complex joint. And usually is stabilized by a lot of ligament. Usually you have some interarticular and extraarticular ligaments, and then you have the palmar carpal fibrocartilage and the flexor retinaculum. So any trauma that would affect these ligaments automatically would cause some sort of instability of a carpal joint. And once you manage to understand where the instability is coming from, then at the point you can start planning what's going to happen next. So usually you probably referred cases for pancarpal arthrodesis, for a carpal damage, whatever, and then sometimes dogs, they come back with a pancarpal arthrodesis, sometimes they come back with a partial carpal arthrodesis, and why in one case you do one and why in the other cases you do the other. That depends entirely by at what level the trauma has occurred. Because you know that if a trauma has occurred at this level, so between the radius and the carpal bones, so the antebrachiocarpal joint, then you know that you're going to have to do a pancarpal arthrodesis, so you're going to have to fuse the entire joint. But if anything happens to the other two rows of bones, so the intercarpal bones or the carpal metacarpal joints, then at that point you can get away by simply doing a partial metacarpal arthrodesis. So the next part of the game is to try to understand where the instability is. This one is just like a quick example of what hyperextension looks like. And then this picture here is beautiful. You can see like that pretty much like the leg is completely like a 90 degrees. Then at a point you know that there is a problem, that there is something that is not right. But as you can see, that dog was actually walking relatively comfortably, as you can see, limping on that leg, but you wouldn't say that he had like such a bad problem like as you can see in this picture. So again, like a part of the game is to try to find where this problem is coming from. So let's start taking some X-rays. We take like a normal X-rays without stressed views, and that's what you are left with. On this case, we stress the middle compartment. So with one thigh, I start pulling this direction. With the other thigh, I start pulling that direction. And you can see that magically here, the joint space starts opening. Can you see that this black area here is bigger than what it should be? Okay, so let me go back 1 second. Can you see? Look here. Okay, and now we go forward. Can you see that it's bigger? Okay, so that's already one sign that there is something not right. And so that's on the medial compartment. Then this one is the lateral compartment that we are checking. So with the thigh, we pull in that direction there, and with this one, we pull in this direction. Can you see any problem there? Looks pretty good to me. And there is no black space between bones. So we can, at that point, we can say that the lateral compartment is fine. And then we do like a dorsopalmar stress views. And what do we have? Poof, this little tiny piece of bone that comes out. Okay. And then at this point, if we go back, you can actually see that, actually here there is something that is not right. And then if you actually look better, you can see that there is a lot of soft tissue swelling. Okay, all this white that you can see here, that's soft tissue swelling. So then you do a stress views, and automatically you can see that there is like a severe instability at this level, which is, this one is like probably the number 1 or 2 that is luxated. So you know that like the problem is a level of distal rows of bones. So the treatment would be partial carpal arthrodesis, exactly. Okay, so here we go. Okay, usually, especially like in big dogs, I like to use like it's a hockey stick plate, which is usually you use for distal femoral osteotomy, ostectomies, and it usually fits quite nicely because you can put like a decent amount of screws into the carpal bone. And you see like this joint is perfectly fine, so there is no reason to go and do like a more complex arthrodesis. You can just only get away with doing this one. Then another example. Bella, 9 years old, jumped out of a bedroom window. We got both the right and the left. Which one is the damaged one? Left. Anyone else? Any other opinions? So who said left? Why do you say left?
There's something with the 2 rows of carpal bone there. It's a lot more loosely arranged from where I'm standing rather than...
Yeah, exactly. So if you look here, for example, you can see that the joint space here is not as on the other side. So we're looking medial. So if you compare these 2 joint spaces with this one, you can see that this one is a little bit more open than what it should be. And then when we start doing the stressed views, you can see that like the metacarpal bones, they are completely luxated. So again, like a damage to the carpo-metacarpal joint. And that's something that you can see only with stressed views. So if you have any doubt and you don't know exactly what's going on, just try to crank it open and see where it's broken. So you're not going to make it any worse. So just try to crack it open and see if you can see where you can see more black. Okay. It will need surgery anyway, so it's okay. You're not going to damage it anymore. I almost forgot to tell you, do you know what the biggest difference between dogs and cats is with regards to the carpus? Give you a hint, ligaments. Medial collateral ligaments. No, that's not the difference. The main difference is that like the dog has like a long portion and an oblique portion, okay? Ligament, medial collateral ligament. The cat only have the oblique. So pretty much it's just enough a little damage of a ligament, and then automatically the joint of a cat is all over the place. Okay, so like it's much more likely that for a little damage of a medial collateral ligament, you're going to end up doing surgery like a fusion in a cat than in a dog. In a dog, you might get away by simply putting like maybe a cast support for a little bit longer. Instead, with a cat, is less likely that you're going to get away with. And this one is still the same case where pretty much had instability on two different planes. So it was medial on this case, and then it was also like a palmar instability. Okay, so then let's see the next disease, the Tenocinovitis of the abductor pollicis longus. That's something that you don't see very often, but then I would say probably like I see maybe 2 or 3 every year, so it's just worth to know that is there. This one of it was a case that was very obvious, and it's pretty much, it's like if we were talking about the tunnel carpal syndrome in humans, exactly the same, where you got like a tendons that get squeezed by new bone. In particular in dogs, what's happening is that you have the beginning inflammation of a tendon sheath, and then what's happening is that the inflammation becomes chronic, and then you start having like new bone growing around the tendon and start squeezing the tendon. So usually these dogs, they are incredibly painful when you try to flex the pollicis, so like the first digit, or they are incredibly painful if you try to extend it, to abduct it. Okay, so usually if you have a dog that has got like some sort of swelling here, some radiographic changes here, and then it's very painful when you manipulate the first digit, then you know that most likely that's what you're dealing with. And usually on the x-rays, here you have a little tiny groove just next to the styloid process, and usually you can see like a new bone growing there, and literally like kind of like causing a compression of a tendon. Most of the time, you get away by simply injecting some steroids along the tendon. Usually it's enough for the cases that are not as bad as the one that I showed you just 2 slides ago. Sometimes you need to do surgery. So like on this case, this one was the dog, it was a German pointer, and then on this case had to do surgery on both legs because he responded to the injection of steroids for 1 year. So for 1 year did very well, and then the year later he came back saying he's still struggling to walk. And then, so pretty much like this one is the tendon and comes down, and then this one is a lot of new bone growing around the tendon. So it's a matter of just only going there with a burr and just only get rid of the bone. In this case, you can see the tendon that goes and disappears completely inside the bone, and in theory, that's not, I suppose, how it's supposed to be. Something else that you can see, severe osteoarthritis. This one was a Westie that we saw 2 days ago, and then he had like some septic arthritis that destroyed completely the joint. And the dog, when you try to flex the elbow, the carpus like is extremely painful, and the range of motion inflection is severely restricted. Let's move up to the elbow, which is my favorite joint. So. Most of the time, the vast majority of the time, when you see a dog coming for frontal limb lameness, that's always due to an elbow problem. That's the vast majority of the times. Again, a lot of times I get dogs referred for shoulder pain, but then again, like out of all the cases for shoulder pain that I've been referred to, probably 90% of them are elbow problems. So remember that elbows is, most of the time, is the joint that you need to focus on. So I usually, again, like being systematic, I start for the carpus, then I start going up, pressing along the bone to see if it's got any pain. That's true especially in younger dogs, because sometimes if I have panosteitis, for example, and you start squeezing the bone, you might get a painful response. So brilliant. And so then you reach the elbow joint. So usually there are like 3 things that I check. I check for extension. Oh, sorry, 4 things, because then I check for effusion. So what I just did there is that I checked to see if there is any effusion, because here on this side and here on the inside, sometimes you can have like a big blob, a puffiness, and you know that's effusion. So if it's effusion, then you know that there is something wrong with that joint. Okay. Check extension, then checked flexion, okay, to see if there is any pain, and then I checked some abduction and adduction. Then usually I always check to see if there is any pain coming from the biceps. That's what I was doing. I was doing there. So one thing that I always check is pain inflection. Okay. So now you will see, like most of the time when you do extension, the dog, it doesn't care, as you can see on this video. When you start flexing, you see the dog that starts moving away from you. It's like, whoa, please don't do it. It's painful. Okay. Sometimes if you have a lot of arthritis, you're not even able to flex it completely because it gets locked there, and you're pushing and nothing happens. So this leg, for example, let's check the left leg. Let's see if it's more painful on this side. You can see it doesn't like extension, first of all. And then you can see, like, literally is the dog like throwing all the body away from you, because it's like, please do not flex my elbow, it's painful. So if you start doing this thing, you will see, like, it's amazing the difference between a dog that has got painful elbow and the one that doesn't have a painful elbow. So for example, if we go back to this one, and if you look now when I'm going to flex the elbow, the dog is like, I don't care. You do what you want, I don't care. Okay. There you go. Let's see. Like, it doesn't care. That's a dog that has got like a normal elbow. Instead, we started doing this thing on a dog that has got painful elbow, like for example this one. And you start flexing, it's like, whoa, no, please, please, please don't do it. Okay, that's what I call the meerkat test, because usually we tend to see it like this, like a little meerkat, you know. That's what they do. That was the left elbow, and now if you check, the right one is even worse. It looks more like a meerkat than the next one. Actually, careful, wait, there you go. That's exactly the same. All right, the meerkat test for you. Okay, so usually check for pain in mainly inflection and extension. This one is just to show you what I meant with effusion, with puffiness, both on the medial and the lateral aspect. Literally, you can see, like, and usually you can squeeze it. It feels like if it's fluid filled, and usually that tells you that there is a lot of effusion in the elbows. I'm not sure why, but usually I tend to see this. Actually, I know why. I tend to see this thing here in young animals. Because usually young animals, they tend to have like an awful lot of, they respond to a problem with an awful lot of inflammation. In older animals, where the joint becomes all dry, you tend not to have an excess of joint fluid like in this case, and usually you have a very destroyed joint, usually with no fluid inside the joint. So now we move to the beautiful elbow dysplasia. So everyone talks about it. Everyone knows most of these diseases. So let's just have a very quick look at these problems. Ununited canal process usually tends to affect large breed dogs. Usually is bilateral in around 20–35% of the cases. And usually the lameness tend to appear when the animal is young, so anything between 5 and 12 months, okay, usually. So usually these dogs are dogs that are terribly painful when you do extension, okay, and you do extension simply because, like, pretty much what you do is that you start pressing like this broken piece of bone against the humerus. So you start doing this, and the dog is like, whoa, don't do it, please. So if you have a young dog, that is, it belongs to, like, that is, for example, like a German Shepherd, then you know that, and it's got got pain on extension of elbow. You see, you know that that's one of the things that you need to put on your little list of things to check. So usually, Usually this problem is due to a problem with ossification of a center, with a union of a center of ossification. And usually this center of ossification tend to fuse with the rest of the ulna by week 20 more or less, 2022. So if you see a young dog that has got like an obvious fragment completely detached, like in this case, and the dog is older than 22 weeks, then you know that that fragment is not gonna fuse back. It's gonna be a problem. So at the point you know that you can recommend doing something with the case. Instead, like if you have a dog that is 16 weeks old and you see this thing, you might say, right, let's just hold on, let's repeat the exercise again in another 5-6 weeks, and let's see if this fragment is still detached or if it fused back together with the rest of the ulna. Again, like because it's a disease typical of German Shepherd, when you see a German Shepherd, that's always one of the things that beep, immediately as soon as you see a lame German Shepherd coming through the door with a painful elbow extension, that's one of the things that you need to think about. X-rays sometimes they can show you what the problem is. Sometimes you don't see an obvious line, but you see just only a lot of white. Remember, white is sclerosis, so it means that the bone is not happy. So if you see like a lot of sclerosis, a lot of white up here, like you can see a little bit here around the problem, then at the point you know that most likely there is this problem, and then probably the next step will be just only to do a CT scan to confirm that what the problem is. OCD, osteochondritis dissecans. Usually you call it dissecans once the flap has come off the bone. Usually we do see it affecting the medial humeral condyle, on the humeral head, and then usually in the stifle and the hock. Usually these are the most common location. And again, like like we said earlier on for the German Shepherd and the ununited corneal process, if you see like a large breed dog, young, coming in with pain on elbow manipulation, and it belongs to one of these usually big large breed dogs, usually you know that that's one of the things that you need to watch out for. And usually that's how they look like on the CT scan, which is pretty obvious. You can see like a massive hole that you have in the cartilage there, and this one is on the medial lateral view. And then usually for this kind of problem, usually my preferred treatment is to use the Synacart. It's pretty much like if you had like a hole in the wall, and then you just stick a plug in, and that's it. And so you reconstruct immediately the articular surface, and you fix the problem. It's a little bit expensive because these plugs, they are like 600-700 pounds simply for one single plug, but the results are pretty much amazing, and usually dogs, they tend to recover incredibly quickly from the surgery. Then let's start talking about fragmented coronary process and incongruency. The next chart might be about elbow dysplasia, and so then I can go down in depth into what the problem is and exactly what this coronary process incongruency is. The way, which is a silly way, but the way I like to describe to clients about fragmented coronary process is, so you have a radial head, and then you got the coronary process, okay? That's how they fit. So usually, the way I describe it to client is the radial head is the bully. So we are at school in the morning, you got the bully, and then you got the little kid. The little kid is the coronary process. So every day, the bully pushes the little kid. Push it one day, push it on Monday, push it on Tuesday, push it on Wednesday and Thursday. On Friday, the little kid falls on the floor and breaks his arm. And the fragmented coronary process is the broken arm. Okay, so that's how the silly way of explaining it. So you have two bones that they don't fit properly together, and on my example, you have two kids that they don't fit properly together. So, like, what's the solution? You put like the bully in one room and the little kid in the other room, so the bully cannot reach the little kid anymore, which means doing a subtotal coronoid ostectomy, an SCO, where you remove a little wedge of bone between the radial head and the coronary process, and problem solved. Okay, so that's how I like to explain it, which is a silly way, but then usually tend to stick to memory. Instead, when we are talking about incongruency, that's a different kind of incongruency, because then at the point we're not talking about a problem between radial head and coronary process. We're talking about a problem between coronary process and the humerus on the top. So what's happening is that the two are rubbing. Usually the cartilage goes away, and that's when you end up with having serious issues. So usually the fragmented coronary process is something that is in young dogs. Okay, so dogs that are anything between 6 months and 2-3 years old. And then instead the incongruency is something that I tend to see in older dogs. So again, the first one in young dogs is a loose bone, okay, a loose fragment, a broken arm. Instead, like an incongruency usually tends to lead to a lot of cartilage damage and like a naked bone, because pretty much all the cartilage goes and you end up with a naked bone that is rubbing, the two bones rubbing against each other. So again, remember, you see like a young Labrador coming through the door, you try the test, the Meerkat test, and you got some pain, and it's likely that this dog will have like elbow dysplasia, and even more likely that he's going to have a problem with his coronary process. So again, just to give a rough idea, that's the bully, the radial head, this one is the little kid, okay, and this one is the broken arm. So usually when I was talking about removing the wedge, it would be like removing like a wedge here of bone, where of the coronary process, where I remove the fragment and I remove a little bit more of the coronary process in order to put the two kids into different rooms. Okay, so that's how I do it. Usually, these cases usually they have minimal changes on radiographs, and in a moment we're going to start talking about radiographs, which is something hopefully that is going to help you in general practice. The second category, older dogs, so usually anything from 4 years old up, where usually they tend to be constantly lame, so not just only in the morning when they get up. And then this dog, because of the amount of arthritis that they can have a reduced range of motion in flexion and extension. And this one are the naked bone that I was telling you about. So again, little kid, the coronary process. This one is the humeral at the top. The two bones, they don't fit, so they start rubbing one against each other, and all the cartilage goes. So remember, like a good joint is white, a bad joint is pink. Okay, in this case, it's all pink. We know that that's a very bad joint. So let's start talking about something that is some tips, something useful for you. So when you take some X-rays in general practice, usually I do recommend to take like one view of the elbow, one mediolateral view of the elbow extended, one of the elbow flexed, and one craniocaudal. So why 3 X-rays? Because sometimes, for example, on these X-rays, I can see things that I cannot see on that one. So let's start. First thing that I try to look for. So I go and I have a look at the front of the radial head. Okay, I try to see if there is any new bone formation there, any osteophytosis, any osteoarthritis, however you want to call it. So if there was a problem, you would see usually that there are some spurs of bone there, some rough bone growing there. Then second point here. So I try to see if I can follow the line, the cranial border of the ulna, of the coronary process. Usually if you have a problem, that border tend to be blurry, so you don't see like a nice line going up. So again, that's the second thing that could suggest that joint is not happy. Third thing, we go and have a look on the top of the coronary process. Okay, and that's something that you can see especially quite well if you have a flexed views, because if you have like an extended view, for example, like you have the humerus is overimposed, so sometimes you can miss some new bone formation down at that level. And then fourth thing, you try to look for some subtrocular sclerosis, so the white area. Again, white means that the bone is not happy, because there is somewhere else, there is a problem. This problem causes the inflammation, and the inflammation makes the bone harder, whiter. Okay, so again, look, try to start paying attention to see how much white you can usually see in that area. Sometimes you will realize that, like, if a white starts going up, usually, or it becomes thicker, usually you know that, again, that joint is not a happy joint. Then we move to the craniocaudal view. Usually you look for incomplete ossification of humeral condyle or fissure, or however you want to call it. So you try to look to see if you can see like an obvious black line. And then we look for an OCD lesion. So you try to see if there is like a big black hole there at level of the medial humeral condyle. So these one are the things that you need to look for to see if that joint is not a happy joint, because then if you have like a painful dog on elbow manipulation, and then on the x-rays you can see that that one is not a happy joint, 1 + 1, 2, it means that that dog, probably the pain is coming for sure from there, and that dog most likely in this case would have elbow dysplasia. Okay. Again, a lot of time it's something that it drives me insane. Is like I get dogs that come here and they say, yeah, my vet just said that it's arthritis. Here you go some Metacam, here you go some anti-inflammatories. Usually if you see arthritis, it's because there is a problem. Okay, so it's a problem that most of the time can be fixed. So of joints that can have arthritis without having like a treatable problem, you have only maybe the shoulder or the digits. Okay, so these are the only joints where you can have some arthritis, but then that arthritis is not the real source of pain. But then otherwise, if we are talking about elbow, if we are talking about hips, if we are talking about stifles and hock, if there is arthritis, it's because that joint is not happy, there is a problem, let's do something about it, rather than just only, here you go, Metacam, happy days. Okay, so the previous case was like a normal case, a normal dog. Instead, this one is a diseased elbow. So do you remember I was telling you about the spurs of bone, the osteophytosis there at the front? That's how it looks like. Do you remember me telling you about the sclerosis? So you can see all the white area that goes from there all the way down to there. And then you can see here at the top that there is again some rough bone there on the top of the anconal process. On the craniocaudal view, I don't see like a black hole that suggests an OCD lesion, but then I can see a lot of arthritis, like some big spurs of bone that again, they tell you, look, there is a problem. So, for example, this one is a little test. What can you see? Tell me what's wrong with this elbow, if there is something wrong. Someone brave? Go on.
This is sclerosis.
Yes, that's it. Supertrocular sclerosis. Yeah, sclerosis. Sclerosis will do a job. It's fine. That's it. So you can see like how thick the area of white is. That's a lot thick. And in fact, like the arthroscopy of this dog was this one. So there was a fragment. Beautiful cartilage, all the joint looking white, but then there was like a fragment. Okay, so so even if the changes were minimal, like in this case, that dog still had a serious problem. They needed surgery to sort it out. And then the green circle, just to show that there was no newborn formation at level of the radial head, no newborn formation at level of the anconal process, and no newborn formation on level of the medial epicondyle, and no OCD lesions. When you do a CT scan, then everything becomes obvious again. So again, let's go back to the bully. That's a bully. That's a little kid. That's a broken arm. Okay, you can see the black line, the fissure. Again, here you go again. Bully, little kid. And I know that the quality is not amazing, but then you can see just a black line that goes down the way there. And then this one is the sagittal view of that image, where you can see actually that there is an obvious big broken arm. Then HIF or incomplete ossification humeral condyle, that's something that you see especially in spaniels. At the moment we are doing a lot of research on this topic, and actually I got something very very nice that is coming up about this. So if you see dog spaniels, please send me over for a CT scan because I'm trying to recruit in cases for to try to prove a theory which I can't share right now, but then hopefully soon I can. I will be able to. When you do like a CT scan, it's very obvious how like an HIF looks like. Usually you have like a big massive crack right in the middle of a humeral condyle. And then let's move up and we go to the shoulder joint. So again, this one is a joint that always scared me because it's difficult to examine, and I never really know what to look for. And then in the end, I realized that the shoulder joint can have just only like 2, 3, maybe 4 big pathology. The others, they are so rare that you would barely see them in several years. So usually, again, I just only try to check for extension and flexion to see if there is any pain on shoulder manipulation. Then I try to press hard here where the insertion of a tendon is to see if there is any pain coming from there. And then the other thing that I'm doing now is called biceps test. So what you do is that if you have a dog with a normal biceps, you're not supposed to be able to do this, okay? It's called bicep test. If you do this, then you can say that you have a positive bicep test, which suggests that the tendon is ruptured. Okay, try when you go home, if you have a dog, try to have a look, like you're not going to be able to fully extend it, okay? And that's because like the biceps is attached to the radial head and to the ulna, and is attached here, and then it's going to allow you to fully extend the shoulder joint. If at the same time you try to also like to press, to squeeze just only with one finger where the insertion of a biceps tendon is, and you get a lot of pain, you know that it's quite likely that that dog has got like a painful biceps. So yes, I was saying, like, if you manage to get some pain when you do the biceps test and you at the same time you press on the craniomedial aspect of the shoulder, you know that most likely you have a problem with the biceps tendon. Then at the point, if you well, just give a little bit of anatomy, just to show you where the biceps tendon inserts. Okay, so usually you tend to have like a rupture at this level. So usually that's where you try to press with your finger when you're doing the biceps test. Said so, like if you do biceps test and this is positive, just out of curiosity, try it on the other side, because in the past I had dogs where they had a positive bicep test on both sides, and the dog actually had no shoulder problems. So again, I don't want you to go and think that their shoulder is a problem simply because you got a positive bicep test. So check always on the other side as well to see if it's the same or if it's not. That's the biceps, how it looks like. So that's why I was saying that you're not supposed to be able to fully extend the elbow joint, because you're going to have the muscle that is going to stop you from fully extending the elbow joint. Most of the time, again, when you have like a pain on focal pressure application, like on this case, and you do a CT scan, so usually that's what you see. You see a lot of new bone formation growing around the tendon, so the tendon is literally there in the middle. And it's pretty much like when I was telling you about the Tenocinovitis of the abductor pollicis longus. So you have a lot of inflammation. Inflammation causes formation of new bone, and then these new bones start growing around the tendon, and eventually start impinging the tendon. So that's why you have pain when you manipulate the shoulder and when you press some on that region. You can also have shoulder instability. Again, I must have seen like 3 cases in my life about shoulder instability. Usually it tends to affect always like little dogs, and usually you tend to have instability on the medial aspect. So if you try some abduction of a limb, usually you get like a massive abduction like on this case. So usually you need to have like your dog sedated. You need to put your hand on the scapula in order to keep it still, and then you try to lift the leg. There was this paper done in the States a few years ago where they came up with these ranges. Again, like I kind of like, I don't like to rely on numbers like these. I always prefer to check one leg and then turn the dog around and check the other leg, because it depends by how hard you are in pulling, depending by if you put your hands properly. So always check the other leg as a precaution. But again, as I said, like I've seen like just only like 2 or 3 cases in my life, so that's not something that you see quite often. But again, like you wouldn't see it usually in big dogs. Like in this case, usually you see it in smaller dogs. Another disease that can affect the shoulder joint is an OCD of a humeral head. On the X-rays, you can see that there is like a hole pretty much there on the caudal aspect of a humeral head. You do a CT scan and you can see it beautifully, and that's the reconstruction of that image. And this one is actually like a picture from a paper that I published last year about using the Synacart implants that I showed you earlier on to close the hole. And that's how pretty much the implants look like. On the implants there is like a part that is metallic, which is like a mesh where the bone grows into, and then it's going to help us in the future keeping the bone still. And then there is like a piece of plastic on the top, which is the one that reconstructs nicely the joint surface. This dog, again, they're young dogs, always young dogs, large breed dogs, with a lot of inflammation and effusion in the area, and they tend to be extremely painful if you squeeze with one finger on the back of a shoulder joint. This lesion, you can have it here in the center, or you can have it a little bit more medial. Usually, if you look on the literature, they say that the one with a lesion in the center, usually they carry like a poorer prognosis. So the dogs, even if you treat it, like they don't tend to do so well. But again, like that's based on using the traditional techniques where you go inside, you just make some tiny little holes in the bone to try to allow the blood to come out and try to fill up somehow the hole with some scar tissue. Since I started using this one, I had no problems, and even if it's in the center, even if it's more medial, usually dogs that tend to recover quite well. Osteoarthritis, that's one of the other things that you can see. These two are particularly bad cases. In a case like this, probably the only solution would be like arthrodesis, or in some cases like you could do a shoulder replacement. That's pretty obvious. I don't need to tell you about osteoarthritis in the shoulder joint. The only thing I want to ask you is that when you examine, and that's probably the reason why so many vets refer cases for shoulder and it's not shoulder, is something else, in particular the elbow. People, when they do the examination of a shoulder joint, when they try the extension, that's what they do. So they put one hand under the elbow and they start putting the leg forward. But then, like you see, like at the same time, you're extending the elbow joint. So most likely the pain is coming from the elbow because you are fully extending the elbow rather than coming from the shoulder. So if you have to check like the extension and flexion of a shoulder joint, try to not to grab the elbow, maybe try to grab the humerus and try to move the leg simply by holding the humerus in your hand, because otherwise you're going to think that the pain is coming from the shoulder, but in reality it's coming from the elbow. We are nearly there. Quick slide about panoosteitis. Do you remember when I was telling you when you start manipulating? So you start low and then you start going up. So between the carpus and the elbow, start feeling the bone, start squeezing hard with your thumb on the ulna, because usually the ulna is I think is affected in, if I'm not wrong, like 43% of the cases. So in order, I think is the ulna, then is the humerus, and then is the tibium, something like this. So most commonly is the ulna the one that is affected, and as you probably know, like a panoosteitis is just only like a self-limiting inflammatory reaction of a bone marrow, and usually tend to resolve. So if you do like a CT scan, that's a normal elbow, and this one you can see all the white paste inside the ulna. But again, that's pretty obvious on the X-rays, if you take some X-rays. And then lastly, so pretty much like talking about neoplasias, if you see a dog that comes through the door and is non-weight bearing, and especially if it's an old dog, you know already pretty much for what you're looking for, because unless he has a fracture or unless he has like an abscess, an infection, it's going to be a neoplasia. Usually these dogs, as you can see, like they are incredibly lame, and usually they are incredibly painful when you squeeze on the bone. So again, like if you get used to this thing of starting from the bottom and coming up, squeezing the bone, check the elbow joint, and then going up and squeezing the bone, and then checking the shoulder joint, you're gonna get a lot of pain coming from the bone if you have a tumor like this. You see. So pretty much like here there is no on the left, here like a tumor of a distal radius, and usually you see like a lot of black and a lot of white around, so a lot of lysis inside the medullary canal and a lot of periosteal reaction around at level of periosteum. And the other important thing is that you can see that usually these dogs, they have an awful lot of muscle wastage, a lot of muscle wastage. So if you have a case like axel, I got sent these x-rays a couple of weeks ago, where pretty much like the vet was describing everything like it was looking like a tumor. So even before I seen the x-rays, I thought that's a tumor. Okay, so if you have like a 15 years old dog, so a very old dog, from 8, 9 up, and especially if he's a lurcher or if he's a greyhound or if he's a flat-coat retriever, and you have acute onset of lameness without history of trauma, and the dog is not putting any weight, and the dog is very painful, then automatically you know what your answer is. You don't even need to look at the x-rays, because that's what it is. So in this case, like the dog had a massive tumor, and then it developed, in this case, like a pathological fracture. And the vet was telling me, yes, I think that maybe there is a fracture, and I was just wondering if there is a lysis of a bone. And just simply the history should tell you that, yes, that's a tumor. So again, I know that for me it's easy because that's what I'm looking at every day. So pretty much you start automatically categorizing breeds and age, and automatically in your head you already have a diagnosis even before seeing a case. Instead, I do understand that in general practice it's more difficult to associate like one breed to one orthopedic problem. But if you start kind of doing some mental exercise, and if you start doing your orthopedic examination in a very systematic way every time, then it will become kind of like automatic to you. I remember when I was back at uni, I was thinking, I will never be able to learn like the German Shepherd got this problem, and I don't know, the Spaniel's got this other problem. But then it's just only because you do it all the time, it's a constant exercise, then it becomes boom, 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 automatic like this. So again, if you see like a dog that is old with sudden history of pain, and he got no muscle. Sometimes I had dogs referred for elbow dysplasia, and the dogs, I think it was actually like where is it? It was actually this dog here on the right side, and then it was referred for elbow dysplasia. And you think, come on, like you see that you got no muscles left caused by the atrophy. The dog was in excruciating pain, not putting any weight, cannot be elbow dysplasia. Okay, so pretty much the take-home message with regard to neoplasia is that if you have a dog that comes through the door and is non-weight bearing, it can only be 3 things, unless it just slipped down 30 seconds before coming through the door and then like it jarred his joint, whatever. So if a dog comes through that is non-weight bearing lame, it's either a fracture, either an infection, either an neoplasia. Again, it's a game. You know that this one has 3 solutions. You just need to find what the answer is. Okay, just always think about these 3 things. You will get an answer. Okay, and just going back, just finishing the whole thing. Again, how do you know if it's a muscular lesion, if it's a joint or bone problem? So usually, unfortunately, like for us, it's not like for humans where they tell you it hurts here. it hurts here, it hurts here if I do this, you know. It's kind of like it's a diagnosis by exclusion. So if you do x-rays of the carpus and the digits and the radius and the elbow and the shoulder, and when you see absolutely nothing on the bone and the joint, then at a point you can say, well, it can only be like a muscular injury. Okay, so then at that point, what I've seen is that a lot of vets, again, they tend to rest the dog for 2 weeks, anti-inflammatory, here you go, and the dog goes lame again. Remember that when you have like a muscular injury, it takes ages for the bone, for the muscle to heal and get better again. So usually, what I tend to tell them is, yes, I give you some anti-inflammatory for 2 or 3 weeks, but then you're gonna have to rest the dog for 2 or 3 months. Okay, so it's a long period of time. Again, resting the dog doesn't mean that you're going to stick your dog in a cage and then it's going to rot in there. It means that like you're going to just only simply stop him from running and jumping, because that's what damages the muscles again. So the dog stays in a cage, and then when you take him out for a walk, and you can take him out for a walk 3 or 4 times a day, it has to be always on the lead. Okay, always on the lead. And usually these cases, if treated with exercise restriction, usually they do well at the end. Instead, like if you just tell the owners, no, 2 weeks and then you can walk, you can run again, usually what's happening is that the dog starts running again and the muscles get injured again, and then we're back from square zero. Okay, so diagnosis by exclusion, and usually just only controlled exercise rather than strict cage rest, and that's it. And that's it. If you have any questions, or if you have any advice, you need any estimates, you have x-rays you want me to have a look at, just send an email to the email address. I'm more than happy to help. Thank you very much for coming. It was a pleasure to have you here.